Okay, let's start. Uh, Good afternoon, everybody. My name is Evert-Jan Hogewerf. I work for an organization in Bologna in Italy, which is called AAS. And I also happen to be the co-chair of the Person-Centered Technology Membership Forum of EASPD. Very much welcome to this webinar, which is dedicated to assistive technology from policy to practice. Before we start, just some technical information. This webinar is being recorded, so please take that into account in case you do not want to be registered. Either change your name or and then close your camera. Your microphone will be muted to ensure the quality of the session, which means that questions could be asked in the question and answer facility of Zoom, which you can find at the bottom of your panel. And of course, you can use the chat box for comments and whatever, or sharing links or whatever you want. Finally, we have closed captioning, and you can either click on the closed captioning button, which is at the bottom of your Zoom panel. But there's also an opportunity to click on the link that Dimitri is sharing with you in the chat box. And that the subtitles you can move them from on the position that you prefer on your screen. So thank you very much for being here. Before we start, I'll just would like to give a little bit more information about what EASPD at the moment is doing when it comes to assistive technology and person-centered technology. We are preparing an important conference in Brussels on the 13th and the 14th of October, and you're very much welcome there. There will be more information on the website of EASPD soon. And the topic of that conference is The Future is Now, person-centered technology to empower people and disability services. We're all coming out of the pandemic, and more than ever, it has become clear the importance of person-centered technology for empowering the person we support, but also to empower our services. So that is the theme of the conference. It will be very much forward-looking, what we can expect. And to prepare that conference, we are holding a rather large amount of webinars over the next month. This is the first one, so we're kicking off today with the policy and practice. Then there will be one next week on technology trends, and then you can scroll the list. There's one on technology for persons with cognitive disabilities, AAC, for persons with deaf blindness, technology to facilitate leadership and self-advocacy, and the final one is on barriers and opportunities of technology adoption. We hope to see you in many of those webinars, and you can definitely find a program on the EASPD website. So today it's about from policy to practice, and that's actually quite an interesting theme because, as you know, you're definitely familiar with many of the high-level policy frameworks that are around. To start with the UN Convention, but also the European Disability Strategy and others. But sometimes as service providers, we are very much inspired by those kind of policy frameworks, but there is also some kind of a difficulty to implement them, which is not always easy, and which not only depends on ourselves as service providers. We're operating in markets, there are commissioning bodies, maybe some of those policy objectives are really over-ambitious. So what we want to do actually today is to look into how we can translate policy that is developed at higher levels. Very often I have to say with the involvement of persons with disabilities or service providers, how that can be translated into practice. And we have a very nice couple of speakers today. We'll start with Constantina Leventi from EASPD, from the policy team, and she did a research in how assistive technology and person-centered technology comes in a couple of those frameworks. Then we're honored to have Karel van der Porten from the European Commission, who will shine his light on the theme. Julia Aljero from the World Health Organization, from the GAATO team, for those of you that are familiar with that initiative of the World Health Organization. And Julia is substituting Chapal Kasnabis, who's unfortunately could not make it today. So thank you, Julia, for stepping in at the last moment. Then we will listen to Camille and Laura from the European Network of Independent Living. And then we'll have a panel discussion with 3 representatives of service providers, who each with from a different perspective, will respond to some of my questions, I hope. So thank you very much again for being here, and let's just kick off, and I'll hand over the floor and the microphone and the screen to Konstantina.
Thank you, Evert-Jan, and hello, everyone. I will be sharing my screen. So hello, everyone. My name is Konstantina Leventi, and I work at the ASPD as a policy and project officer. And today I will give you an overview of key policy frameworks in regard to assistive technology. First of all, I thought that it would be interesting to start by clarifying some terms that are very much interconnected, and these are accessibility and the today's topic, assistive technology. When we are talking about accessibility, we are talking about how accessible is an environment, a service, or a product to as many people as possible, including persons with disabilities. And we can have accessibility in transportation through ramps, in also buildings through ramps or through elevators and other features. At the same time, we have assistive technologies, and this is an umbrella term that includes products, services, which these help to either maintain or even improve the independence of individuals. And they also participate, and they also improve their participation, facilitate their participation in everyday life, education, work, leisure activities. These are more individualized, and these are more to further enable people to participate in all aspects of life. For example, I have included an image here which shows a chair lift, and this can be built in the staircase of a house, and this, for example, can facilitate access to the second floor for an individual living in the house with mobility limitations. Now back to the policy frameworks. I think that it is important to start from overarching frameworks, and this is the UN Convention on the Rights of Persons with Disabilities. We see that accessibility in the convention is under the general principles that assistive technology, the availability of assistive technology is in the general obligation of member states, and also the convention includes the term universal design. And what is universal design? This is a design of product, of services, of an environment that can be used by all people at the greater extent possible without adaptations. And by following the principle of universal design, technologies should be accessible to everyone on an equal basis. Assistive technology can also facilitate and can enable persons with disabilities to live independently and being included in the community. And also, it is important that member states ensure personal mobility with the greatest possible independence for persons with disabilities by facilitating access to assistive technology. Assistive technology is important to be used also in relation to habilitation and rehabilitation, as well as in education, because in order to have inclusive education system, we need to also provide reasonable accommodations, and part of reasonable accommodations also includes the use of assistive technology. We also need work environments that are open, inclusive, accessible for persons with disabilities, and we need to ensure that reasonable accommodations are also there provided. As we have said so far, assistive technologies can facilitate participation of persons with disabilities in all aspects of life, and this also includes their participation to the political life. Last but not least, member states are also requested to engage in international cooperation, and that also includes facilitating access and sharing of assistive technologies. There are different EU legislative instruments. The first one that I will describe today is the European Accessibility Act, which includes requirements to ensure the accessibility of mainstream digital services and products for persons with disabilities, and that includes both software and hardware. Then we have the Web Accessibility Directive, which provides requirements for public bodies to make websites, mobile applications, and communications more accessible. And here I would like to also include that these will be evaluated by 2022. Then we have the Electronic European Communications Code, which covers telecommunication services, and the European Standard on Accessible ICT Services, which includes requirements on how to make these products and services accessible. And this includes both website, applications, and more. These ICT products can either be used directly because they have an accessibility feature, or they can also be supported by assistive technologies. And here in this slide, I have included two pictures. One of them shows an external braille keyboard, which can be connected with a tablet or a mobile phone, and can be used by an individual with a visual impairment. Or in the second image, it shows a tablet that has already an embedded braille keyboard. Recently, by the European Commission, communicated the strategy on the rights of persons with disabilities, and accessibility is one of the key elements included in this strategy. Accessibility is mentioned as an enabler of rights and as a prerequisite for equal participation of persons with disabilities. This includes accessibility in transportation, in buildings, accessibility in receiving information, but also increasing connectivity, and mainly digital connectivity, among persons with disabilities. A key flagship initiative which is communicated with the strategy is the Accessible EU, which will be a European resource center, which will bring different experts and national authorities representatives which are responsible for accessibility in their countries. It will bring all this together to share best practices, to influence policy developments, and also facilitate the implementation of EU law. Regarding related to the strategy, I will not mention the other initiatives in regards with accessibility, but I will just mention some elements of assistive technology which are included in the strategy. First of all, the Commission will examine the functioning of the internal market of assistive technology. That means that in different member states, we have diverse rules in regard to product eligibility and product certification, and that may harm the competitiveness of prices. Assistive technology will also is also included in the Digital Education Action Plan, as it states that member states will be supported in securing this technology in order to have inclusive digital education environments. Also, under the Pact for Skills is the blueprint for sectoral cooperation on skills, which brings together social economy actors in order to identify the needs, the digital skill needs in the social economy sector, but also how to apply assistive technology for better employability. Lastly, we see also that the EU will reinforce its role globally by advocating for the rights of persons with disabilities, and that also includes assistive technologies. Regarding the digital agenda, the Digital Europe agenda, we see that there is an initiative to improve labor conditions of platform workers. It is important to mention that there are more and more online platforms, and by online platforms, an example that it might be familiar to you is Uber. For example, this is an online platform, and we see this type of platforms also used by companies which are active on the field of care and support for persons with disabilities, older persons, and children. This this initiative is essential, as the online platforms needed to ensure that there is equality in the services provided through a well-trained workforce, and that they offer decent working conditions. This was a brief overview of key policy frameworks in regard to assistive technology, and some also in accessibility. And if you would like more information, you can always reach out to me. This is my email address. Thank you very much for your attention.
Fantastic. Thank you very much, Konstantina, for this overview. I forgot to mention that as a membership forum of ESPD, we are currently developing and writing a policy paper on technology and care. And Konstantina is doing part of the background research for this. So thank you very much for those early findings. It's clear that accessibility and assistive technology are closely connected. Accessibility seems to go for the major in those policy frameworks. Those of us that work on a daily basis in the field of assistive technology, supporting persons with disabilities, actually are aware, like most of you, I suppose, that assistive technology nevertheless remains utmost important for for many people with disabilities. I'm passing the floor now to Karel van der Porten from the European Commission. Thank you again, Karel, for being here. And you know the theme of the day: how do we translate this policy into practice? And maybe you can shine your light on that issue for the time you have available.
Thank you very much for the invitation. Also, thank you very much for organizing these events on this topic. As you know, this is a topic very much in the interest of DG GROW, where I'm currently working for. So the Director General for Industries, for SME policy, for the single market, and for innovation policy, industrial innovation policy. Why is assistive technology so important for DG GROW as such and for the European Commission? First of all, I would try to switch or turn the title upside down. You write from policy to practice. But if we are very honest and modest, it's rather from practice to policy and again to practice, because what we see is that the biggest pioneers on creating these type of technologies are ahead of policy usually, and the policy is always behind and wants to push and to regulate and to stimulate. But if you see in the world of social economy, which is my main field of experience and domain of action, the most innovative businesses creating supportive or assistive technology, but also the platforms, alternative platforms, are way ahead on policy, and policy is always a follower. Sometimes the developments are going in a very negative dimension as well. We need to be honest. Uber was already mentioned. Uber on the one hand can be a huge leverage for people with disabilities in terms of their mobility, but it might also be very negative in terms of respect of labor rights also. So there are very different ways of analyzing and following these evolutions. But within the social economy specifically, we see that a small but very strong group of pioneers is developing very much or very specific, more, let's say, human-centered technology, or civic tech, if you like. Tech for good is another concept that is very omnipresent. Also very much related to digital social innovation. So another concept on top of the rest. All things that are emerging very much bottom up to provide certain solutions for people with disabilities, but also people, for example, with a distance to certain services, which are lacking certain services from the government, but also from the, let's say, more private initiatives. And in my specific domain, with the distance to the labor market. And Konstantina gave a great overview of assistive technology in terms of accessibility, the wider phenomena. But for us, we are really much focusing on employability and how assistive technology might support people in doing their job, or might support people in getting a job which they would maybe not have otherwise. And that is a huge leverage, because today we see that in some regions, for example, there is a huge unemployment rate, but in other regions there is a huge lack of supply of people to fill in certain jobs. And we see that governments try to change their attitude towards different target groups and try to find solutions to also but provide these people a job to fill in the open vacancies. And their assistive technology seems to be a quite interesting tool and has a lot of potential. Nevertheless, it requires a lot of capacity. It requires a lot of money, but also a smart way of dealing with that. It depends also on the organizational form that you apply, or that is on top of the usage. It cannot be the intention to promote certain technology to fire people or to be more productive and to save money on people's side. When we talk with, let's say, managers of these so-called work integration social enterprises, they say we want to have a robot, a cobot, what they call a collaborative robot, so a robot that is assisting somebody with a disability or a handicap, to hire more people. We don't want to have a robot to fire people. And this is of course a very important principle that where everything is related to. If you don't have this intention as an employer to hire people with a distance to the labor market, then you will never use the technology in a social and inclusive way. And then, of course, you need the knowledge. It's not developing on their own. It's rarely one single enterprise that is making such type of technologies. They rather pool the resources of a group of enterprises, and they provide technology towards the specific need of each individual enterprise. One of the most advanced examples we have in Belgium, where some members I think are present here as well, which is the Vierwerk group, which is what we call in DigiGrow a cluster, an industrial cluster, but in this case an industrial cluster of work integration social enterprise. And they have jointly set up a research institute, a specific research institute to develop supportive or assistive technology to support their employees in doing their job. That might be on a cobot, that might be laser technology, augmented reality, adaptable workspaces, and so on and so forth. I can definitely recommend to invite those people in one of the sessions here, because they can explain 10 times better than I do how they do it, what they do, and what is the added value. They should really be pulled to the European level to explain their experience and to mainstream this also in other countries, because they have invented this, they are rolling out, and we slightly find some other examples in other countries as well. And that is specifically why we have set up this this blueprint on sectoral skills for work integration social enterprises, because we want to support social enterprises that are active in this field to get the right skills on board, to get the know-how on board, and to jointly stimulate technology provision for assistive technology. And that is what Constantina and ESPD, by extension, together with the whole consortia, will do in the next 4 years. We are very happy that this is also listed in the disability strategy as one key action. So I think that is really something we have to keep an eye on, but we need to spread the word more widely that assistive technology is really a tool to first enhance the inclusion of people in the labor market, so people with disabilities, but also, and that is the strength of this model, also enhance the competitiveness of these firms and to be a real economic actor with people with disability, regular people, so people without a distance to the labor market, all combined in the same work floor, and to make more equality at the work floor. So I think it's a very beautiful principle where we need to invest a lot of time and also money. The Commission is really happy to support you on this. We hope we can do it first with this project, and we have a lot of follow-up afterwards. Thank you very much for my time here. I wish you a very, very good follow-up discussion, and please let me know how that went, because I need to leave this meeting, unfortunately. Thank you very much.
Thank you very much, Karel, for your intervention. I think Karel raised some very good issues. He shifted basically the focus from the technology to the area of employment. So where it is used, how it is supporting life areas or important life areas of people. And I think he also focused on with this on the whole discussion on the impact and the outcomes of assistive technology. Now I'm very happy to introduce to you Julia Aljero from the World Health Organization. She's working in the GAATO initiative, and the GAATO initiative, maybe Julia, you can say a couple of words about that. Is really looking into how the World Health Organization can support access to assistive technology worldwide in the next 10-20 years. And they're doing great work. There's some very nice initiatives on that. And Julia is going to introduce us in that topic.
Thank you very much, Everjan. I prepared a few slides, so if it's okay, I'm going to start sharing my screen. Thank you. Okay, can you see the screen? Okay, great. Thank you, Everjan, for the introduction. My name is Julia Aljero, and it's a pleasure to be here today. I work at the World Health Organization in the headquarters in Geneva. And as Everjan mentioned, I support the Global Cooperation on Assistive Technology, which is the WHO flagship program on improving access to assistive technology. And it sits within a unit, which is access to assistive technology and medical devices. So WHO estimates that today 1 billion people need assistive technology, and by 2 billion people, by 2050, 2 billion people will need assistive technology. And this rising need is mainly because people are living longer everywhere. So by 2050, for example, 1 in 4 people will be over 60 years old. Also, the prevalence of non-communicable diseases is rising in the world. and cancer, diabetes, stroke, etc. Represent one of the leading causes of disability. Also, some people, of course, experience disability since birth, and some experience disability at an early stage of life. However, in the future, in the next 20, 30 years, the main user of assistive technology will be older people. So it is indeed a topic that touches all of us. And it is imperative to build a system that can address and accommodate these changing health and social needs. So WHO Global Cooperation on Assistive Technology in 2016. And then one of the key milestones was in 2018 when the World Health Assembly, which is the main decision-making body of WHO, adopted a resolution on assistive technology. Through the resolution, member states requested WHO to prepare a global report on assistive technology by 2022, and also formally requested WHO support in developing assistive products policies and programs to improve access. Also in 2016, the WHO launched a priority assistive products list, which is a list of 50 assistive products to support countries in their process of selecting, procuring, and providing assistive technology. So the resolution and the priority assistive list represent two of the main policy instruments from WHO today. However, when it comes to implementing this policy instrument, such as the resolution, the priority list at the country level, especially in less resource settings, there are challenges. So on the demand side, so on the side of people who can potentially use assistive technology, there is often lack of awareness. So people are not aware of the products they need. And this is also because there is no early screening sometimes to recognize this need for assistive products. And so people do not seek services in the first place. On the supply side, meaning on the service delivery side, in many countries, assistive products are just not available. So even when people access a clinic or a service to get a simple pair of glasses or crutches, those products are not there. Many times because they are very expensive or they are very hard to procure. Another important challenge for service delivery is the shortage of health professional and human resources for health. So WHO estimates a global shortage of almost 18 million health workers. And often, even when health professionals are available, often their education, their competencies and skills do not match the needs of the people. So in cases when services exist, they often work in silo. So assistive technology services in many countries are not integrated within the health system. They sit outside of the health system, and often there are no connection. There is no connection between them. And COVID really worsened all these challenges even further. At the moment, we are conducting the research to see how COVID-19 has impacted access to assistive technology. And we would like to use this information to inform a model, innovative model for service delivery in this new normal context. So in response to the challenges highlighted before, WHO developed a model, a framework to ensure efficient and person-centered service provision. So person-centered policy is, of course, very important. It's the first step, but then we also need affordable assistive products of good quality available. We need a trained and motivated workforce, and we need a provision system that is flexible, that is fit for purpose, and which can meet the changing needs of the population. So to realize this model of assistive technology ecosystem, WHO is really advocating for integrating assistive technology at every level of the health system. So we need to move away from a traditional provision at the tertiary level, where assistive products are provided mainly by specialists, and promote the provision of simple assistive products at the primary and community level, involving also the broad workforce. So not just rehabilitation professionals, but also nurses, community workers, etc. So we really see the community and primary healthcare level as the most important place where people can access assistive products. And at this level, many assistive products can be provided, like simple glasses, walking aids, and also at the primary healthcare and community level, people should receive screening, should be screened for a need of more complex assistive products and be referred to a secondary or tertiary level. To support the workforce at the primary healthcare level to provide assistive products, WHO is developing the training in assistive products, which is a series of online modules. It's a training package online to support community level workers to build their capacity to provide simple assistive products. So the content of the training package teach how to select the appropriate assistive product, how to fit it, how to teach the person how to use them, and also to carry out basic maintenance procedures. It includes assistive products for communication, vision, hearing, self-care, and mobility. We piloted this training package in India, Iraq, Papua New Guinea, and we also have upcoming piloting in Romania and Tajikistan. So we will be happy to share these findings once they are available. And lastly, is also working on a new initiative, which is the AAATE, to complement the training in assistive products, but also to respond to the growing need of remote support services. So telehealth and telemedicine are not a new concept, but so far they've not been widely used for assistive technology services. So we are now exploring how telehealth approaches can be applied to assistive technology provision, and where and when they can be most helpful. We have many more initiatives, especially around the procurement and data collection on assistive products, but unfortunately we didn't have the time to cover all of them today. But I would like to invite you to visit our website and follow us on Twitter and on the GAATO community for more information. Thank you very much.
Thank you, Giulia. That is impressive progress made by the World Health Organization there over the last 10 years. Congratulations with that. It's amazing to see all the work that is done and how you managed to mobilize resources all across the world. It's quite logical that you start from the basic products that need to be provided. But I know that you're also looking into more, let's say, high-tech solutions, and especially your last slide was clearly demonstrating how you're opening up as well to remote support. I think that's all very, very interesting. You mentioned a couple of barriers, in particular awareness and the development of competences, but also fragmented service delivery systems across the countries. Now, I'd like to hand over the floor to Camille and to Laura. Both are representing the European Network of Independent Living, and so their technology users themselves, assistive technology users themselves. And my question to them would be what they would actually expect from how the technology is provided, and how what the role of service providers is in making it all possible for them to make the best possible use of those solutions. I don't know how you divide it, whether Laura or Camille will start, but the floor is yours.
Thank you, Jan. I am starting. I mean, we are usually ladies first, but this time we divided it differently because we want better for us. Thank you for inviting us. It's a pleasure to be here. And it's, I mean, we are happy that you touch ASPD these issues because, yeah, indeed, I mean, we are in 2021 and technology is part of everyday life of disabled people like ourselves, as you said. And yeah, and we also, as we will see also later, there is a connection also with I mean, technology and service providers and I mean independent living, which is the thing we are working on. I will ask my great colleague Laura to share the presentation. So yeah, give us a couple of seconds. And thank you, by the way, Laura. And I will start with saying a little bit about who we are, and then Laura will, and also a few other things, and then Laura will take over and finish the presentation. So we'll go to the next slide, please. And so the European Network on Independent Living is a network. So we are an umbrella organization based in Brussels, from disabled, by disabled, sorry, for disabled people and by disabled people, disabled led. We are across disability, which means that we believe that independent living is for everyone. So not only for wheelchair users, but for blind, for people with intellectual impairments, and whoever, I mean, needs support and doesn't really has the option to live independently at the moment because of the barriers they face, the oppression, and everything. And some of the barriers can be tackled, by the way, by the support of service providers or assistive technology. We advocate for independent living. We are a grassroots organization. Some of our values are self-determination, self-representation, so nothing about us without us, deinstitutionalization, choice and control. This we will see also later. Laura will explain sorry, the importance of choice and control for us, especially the topic we are discussing today. Access to society is important. Sorry, we are looking for things like access to society, like social services, personal assistance. So here is your role as service providers, barriers-free environment, housing, technical aids. So I mean technical aids, and you can also put assistive technology, inclusive education, freedom of movement. And we have members in Europe and beyond. And I want here to say that there is no independent living without assistive technology at the moment. I mean, we use a lot of this to be more independent, be more, free. For example, you hear very often the phrase, a person confined on a wheelchair, but this is not a confinement. This is a way of freedom and way of independence. So this is a lot of assistive technology to support us to be independent. We can go to the next slide. Thank you. So we were also asked when we were discussing, the programming the event, to say a few key concepts of the UN on the UNCRPD. I know that already Kostadina very well laid the floor on that, but I want to bring the perspective. We want to bring the perspective of disabled people and from the independent living perspective. I won't take much time on that because Kostadina already said a lot of things. So I don't want to bother you with the same things. I have chosen a few of articles that I think it's interesting to mention, which address the assistive technology and maybe also the support from service providers. So Article 4, which is kind of in the beginning of the convention, and sets the general obligations of state parties. I mean, it's a big article, so I will not read all of this. But we see that in the paragraph G, that state parties have the obligation to undertake and promote research and development and the availability and use of new technologies. So a clear mention, including information and communication technologies, mobility, devices, and assistive technology. So we see a wide range of options suitable for people with disabilities, giving priority to technologies at an affordable cost. Affordable cost is an important thing because, as we know, disabled people very often are not in the highest level of social scale because of the discrimination, oppression, and all this stuff. So we don't have access to technologies very often for because of the cost. For example, in Greece, I wanted to buy an electric wheelchair at some point, and I went, to a company. I asked it. They told me, okay, it's about 20,000 euros because it's an advanced wheelchair. I still didn't buy it, by the way. And I asked it, okay, how much is the government giving? And they said 3,000. So from the 20,000, the government is giving only 3,000, and the rest you have to figure out. So we know that in many counties, people are returning to charity or whatever, which is not the way it should be. So, affordable is very important. Then, and also availability. Then to provide, and we see in the next paragraph that it says that state parties should provide accessible information to persons with disability about mobility aids, devices, and assistive technologies. Very often we don't know what exists out there and how can we access it, including new technologies as well as other forms of assistance and support services. These also do the connection between technology and service providers, which is, very important for independent living. We kind of should see it connected and not against each other. So service provider technology. Then there is also a paragraph which says that with state parties showed the training of professionals and staff working with persons with disabilities in the rights organized and recognize them, in the convention so as to better provide the assistance and services guaranteed by those rights. So again, a focus on service provider and how they can support us, also with assistive technologies. Now I will very quickly go to the next slide, but this I won't take much because I didn't already said, so there's no point for me to say the same thing. We see some articles that have directly key concepts on on assistive technologies. So I'm always thinking about personal systems as the key issue for independent living, but assistive technologies on equal level. So almost. So we see that Article 9 on accessibility has an importance when it comes to technology, and state parties should promote our access to technology. We see Article 20 on personal mobility, when people should have, access to quality mobility aids, assistive technologies, and all these assistive devices, and even life assistance. And state parties should encourage entities that produce these mobility aids and devices and technologies to take into account the aspects of mobility of all people with disabilities, regardless of the impairment. Then Article 21 on freedom of expression and opinion and access to information. I think here the role of technology is very clear. Article 26 on rehabilitation and rehabilitation. Of course, assistive technologies can support also when we need to shape our future and our lives, maybe, and we need to improve the condition if something happened or whatever. Then Article 29, participation in political and public life. So assistive technologies and all these new age options can help us to participate on equal level in the political life, for example, voting online, or accessing the booth in a way which is accessible for us, and having our privacy and all this stuff. And there is also in Article 32 about international cooperation. There is also a clear mention to technologies and their role, to support economically and technologically people in the places and areas of the world that they don't have the opportunity. And we have today Julia from who is replacing Chapal. And I remember I met first time Chapal in Geneva a few years ago when we were discussing about the role of assistive technology in education for children around the world. So it's important. And these are some articles that we see direct connection to technology and assistive technology, but there is of course a lot indirect, like independent living, education, employment, where all in this one aspect you need both the great cooperation of assistive technology and personal assistance or other support services. Sorry for this noise. And then it's not on my slide, but very quick mention that assistive technology is mentioned also in the EU disability strategy, as we know, especially in accessibility field, employment, and international cooperation. But there is also mentioned in the general comment number 5, and this is something we usually don't hear mentioned, so I want to put here emphasize. And for example, in paragraph 84, and with that I will come close to my speech and will give the floor to Laura. In the paragraph 84 of the general comment number 5, which is the basic tool we should advocate when we speak about independent living, we see that it says that without support for personal mobility, as in Article 20 of the CRPD, barriers to living independently in the community continue to exist for many persons with disabilities. The provision of affordable and available quality mobility aids, devices, assistive technologies, and forms of life assistance and intermediaries, as enshrined in Article 20, is a precondition for the full inclusion and participation of persons with disabilities in their respective communities. So we see a clear connection of technology and service providers and for an independent living. How all this need to work together so we can live independently. And I know that you will think, okay, you put a lot of effort to come into the technology, but what about the role of service providers and technology? And I mean, the service providers play a very key role in independent living. And in most of the things I mentioned, I mean, they will help us. They support us, not help. I don't like the word help because it puts us in the medical aspects on. So they support us to live independently. And so the role of service providers is super important, as it is the role of technologies, but they need to be addressed in the correct way and they need to be used properly, because both technology and service and people can be used in the wrong way, and we don't live independently that way. For example, service providers are personal assistants, but they are also people working in institutions. Or service technology can be wheelchairs or devices that help us communicate or access education, but it could be also cameras or devices that take our freedom of freedoms. So I mean, both can be super important, but when addressed correctly and with the cooperation of disabled people. And I stop talking. I might correct more and give the floor to Laura to bring you to the more interesting part, I think.
Thank you, Kamel. I think it was interesting enough. And I would like to introduce myself. My name is Laura. I won't even try to pronounce my surname. Lithuanian surnames is like really difficult ones, but I'm super happy to be here as well. And today I would like to continue from what Kamel said, and to talk about the important aspects when it comes to choosing the right assistive technologies for people with disabilities. And I think here independence and ability to choose for a person are the key aspects, you know, when you want to find something that might help, you know, a person with disability to become more independent. And I think all of you would agree, you know, that technologies had incredibly improved independence for many people having different types of disabilities or access needs. But we as a NIL would say that choosing the right assistive technology, starting from electronic wheelchairs, ending by, I don't know, any accessibility apps or something, should be a person-centered process. And before doing this presentation, I did some research actually to see if there are any, you know, scientific proof that, you know, this person-centered process is really useful for anyone actually. And I found very interesting studies, to be honest, saying that and proving that when the person with disability themselves are the ones who are picking what they need, it really increases the likelihood and the positive outcomes for using any type of assistive technology. And it also has been proven that this, you know, when the persons choose themselves, when they, you know, are the ones perceive that they know their needs and life's the best, it's really useful not only for them, but it's also useful for for other people and having very good social and economic outcomes. You know, when you think about people with disabilities, sometimes, you know, this attitude comes up that, you know, carers know best, their personal assistants know best, doctors know best, and they know best, you know, what's best for the person. And they start, you know, suggesting things. And of course, they probably have very good intentions. But I would say, you know, that the person is the expert of their own lives, and, you know, they should be the ones making decisions. And I would like to bring a very maybe a bit out of the topic question, but it's also, you know, raising a lot of discussions recently when it comes, you know, with services and technologies provided for people with disabilities. Now there's a very, well, I would say heating discussion saying that will technologies, you know, become a supplement for human-based services? And there have been, you know, many like discussions and thoughts and ideas. And, you know, we're getting used more to the digital environment and digital solutions and digital services, especially, you know, at the time of the COVID. And I'm working currently on TRIPS project, which is aiming to make public transport more accessible for people with having different access needs. That's how I met Evertian, to be honest. He's playing a very important role in the project as well. And recently we had this survey asking people, you know, what they think about the future mobility solutions, such as, you know, robot taxis, flying cars, and so on. But also we asked, what would they use, you know, any smart assistive technology or digital solution, such as like, would they like to use exoskeleton, smart canes, augmented reality glasses, robot assistants, and so on. And we had very interesting results showing that, yes, many people would actually love to use it. And they think, you know, that these solutions would bring independence in their daily life, and you know, they would help them, you know, to live more comfortably, more convenient, like having more convenient life, and so on. But there were also still a lot of people who'd say no. They would still prefer, you know, having a guide dog. They would prefer having a regular wheelchair. They would like to have, you know, assistants as humans than robots. And because they believe that no one actually can replace the human connection and the human contact you create, you know, with another person. So, you know, despite, you know, this growing idea that technologies will, you know, make everyone, you know, very independent, and, you know, it might actually help a lot of people, it is also very important to ask what the person prefers, actually. And for example, I get often, you know,
1 more minute, Laura.
Yes, I'm finishing. I've been also asked many times, would I prefer to use exoskeleton? And I say, no, thank you. And they get really surprised, but you know, it's really about personal choice. So the main message for the last minute, as Evertian said, that, you know, if looking for the bridges between service providers, people with disabilities, and assistive technologies, I think that service providers should be the ones supporting people with disabilities to choose when it comes to technologies. But the choice always, and I would like to emphasize always, should come from the person themselves, because they're the experts, as I've said. And all the policies on all levels should be fully in line with the convention, which Camille talked about, and the general comment number 5. Thank you very much for your attention. If you have any questions, don't hesitate to contact us, and have a nice rest of the conference. Thank you.
Thank you, Camille. Thank you, Laura. That was very, very interesting and very inspiring. And I think it perfectly represents the viewpoint of the technology users themselves. And I can't be more in agreement with you when it comes to the right to choose the technological solutions that best fit your needs and wishes and ambitions. So we've listened to policymakers, we've listened to technology users. It's time to go to the service providers, the people that work on a daily basis on the ground with persons with disabilities, supporting them. And the first organization I would like to discuss with is Centre La Gabrielle from Paris. We have Samuel with us here, and also Yausra. Sorry. Samuel, maybe you can briefly present what you do briefly, please, and
yes,
then
absolutely.
also explain how your service has developed over the last 20 years. What has changed when it comes to the technology uptake and the technology, the use of technology in your services? And have you set yourselves any goals when it comes to the implementation of technology in your services? The floor is yours.
Thank you, Jan, and thank you for the organization. So I'm Samuel Chardon, and I'm CEO of La Clé Digitale, which is an innovation project from the Centre de la Gabrielle. And I'm in charge of the digital inclusion. As a provider, since many years, we have a brand on social innovation project, and I wanted to start, if you don't mind, Jan, to show you what we call the third place. The third place is not a place, so it's not your home, it's not the place where you work in, but it's another place, a third place. That's what we call, and the famous one that you might know is the co-working space, the Fab Lab, and we decide, because we catch a funding for 3 years to so I will reverse my camera to show you where does it take place, if you don't mind. So is it okay for everyone?
Yes, yes, we can see it.
So we're in the center of the city, so in Clé-Souilly, and as you can see, we did open this third place called La Clé Digitale, which is a play word with the city we are in, because it's called Clé-Souilly, and this third place is dedicated for the digital inclusion. So you have a few places in it, a small room, another one to have some to teach, and another one like a mini lab with 3D impression, etc. I do as quick as I can, and another place, another room. Okay, so it's around 80 meters. So we put my camera back, can be back. So I will introduce you Yusra, who is with us as well, because she's a European project manager at Centre de la Gabrielle, and the floor will be yours, Yusra, to present the way we did consider the project. And now Yusra, she's part of the development of La Clé Digitale, and you will see how we want to perpetuate this third place, because someone talked previously about the funding, which is the key. So when the 3 years funding is over, how can we manage this third place and to carry on? So Yusra, the floor is yours, and
all right. Well, thank you so much, Samuel, and thank you, ESPD, for the invitation. I'm very happy to be here. So I'm just gonna do like a brief presentation just to introduce you to the key points that we're trying to achieve. Okay, so can you see my screen? Can you see my full screen?
Yes, it's okay.
All right. So sorry. Yeah, as Samuel said, it's a project that is led by Centre de la Gabrielle. So We are supporting 500 people with special needs, and La Clé Digitale is a space that has been conceived to be in the center of the city for like as much inclusion as we can in a very deinstitutionalization spirit. So we have different axes of development. One key idea to keep in mind is that we want to have a reversed, we want to, how can I say, stimulate some form of reversed inclusion, in the sense that this place has been thought for people with special need, with assistive technology, as Samuel said, with all the devices that we can offer. But beyond this target group, it is also a place that is meant to be open for the general population, since everyone has needs for technology. So this place is also open to anyone who has any questions and wants to improve whatever skills. So that's we work with digital consultations. So it's like when you go to the doctor, you're like, oh, hey, doctor, my head hurts, what do I take? People can come and knock at our door. Oh, hey, I would like to turn on my computer. I would like to create an email. So it are brief and simple interventions that we offer to the general population. So this gives us a place where we can have one room with senior people that can interact with people with disabilities. So it's all about interactions. Second axis of development, we would like to, in a long-term perspective, become a training center for individuals and companies, and also offer some accompaniment with this technology expertise to employment. And that echoes really with what Carol was saying at the beginning of the conference, in the sense that sometimes you need, I mean, not sometimes, but that's the main rule today. If you want to get a job, you need to be familiar with digital tools. So we offer also this kind of training, and not only for people with special need, but for everyone actually who might need it. So, and our last axis of development are other areas that are related to technologies, and we are very much interested in the field of esports, what kind of skills can be developed with very strategic games like League of Legends, Rocket League. And also we would like to develop research and trainings, and we are already in connections with universities to see what outcome can be analyzed out of this form of initiatives. And we would really like, that's where my job as a European project officer makes sense, is that this kind of place that is very much anchored in a very small city in the middle of, I won't say nowhere because we're 30 kilometers away from Paris, but it's still considered a rural area, can be connected to Europe and can be connected to the world, because I believe that other initiatives similar to La Clé Digitale has to interact, and that's why I'm very happy to be here, and hopefully also get to know other structures that have like similar projects.
Thank you.
So that's our partners, as you can see, local wise, also universities and the European level. That's it for me. Thank you very much, and I'll give the floor to the other participants.
Thank you, Salma. Thank you, Yusra. That's a very practical example of how you can turn policy into a very practical service for people, bringing technology closer to them and giving them the opportunity to learn more about it. So thank you for that. That's very fantastic. If there's still time, I'll get back to you with some questions. I'd like to hand over to Donatella now, or welcome Donatella in this panel. Donatella Mattia is a rehabilitation doctor from the Foundation Santa Lucia Hospital in Rome. And actually I invited her because she's living and she's working in a very medical environment. We saw from the World Health Organization how they're nicely, from Julia, how they are nicely connecting let's say, assistive technology to human rights and sustainable development goals and human rights, the UN Convention, so higher level policy frameworks. The question is a little bit, how does that work out in your service, Donatella? Can you tell us a little bit what you do on a daily basis, and then elaborate on the questions of the day?
Yes, thank you, Evertian, for the introduction, and I'm going to share the screen. Just a second. Can you see the slide?
Yep. Okay, it's clear.
Okay. Okay.
Go ahead.
Yes. As I was introduced, I work in a basically medical environment, and it's a Fondazione Santa Lucia, which is a highly specialized hospital for neuromotor rehabilitation, but it's also a neuroscience center and an education center. So these are the three pillars of the Santa Lucia Foundation. As a hospital, we host many persons, many patients actually, who come for rehabilitation of cognitive or motor function due to several and different neurological disorders. We have a multidisciplinary team and programs for the rehabilitation, and of course, within this multidisciplinary program, technology for rehabilitation plays a more and more growing role. As a neuroscience center, we have many labs from basic to clinical research, and so we cover almost all the neuroscientific field aspect of for neuromotor rehabilitation. And also we are a center for education with physiotherapists, speech therapists, pathology, nursing, and with several collaborations with the university in Rome and outside of Rome for several other field in medicine and beyond. So specifically what I do and what we do almost every day. So again, I'm Donatella Mattia. I am an MD and PhD. I'm a neurologist and a neurophysiologist. So I have to say that my training, my background is mainly as a researcher, and and this is reflected by the lab that I'm running now, the neuroelectrical imaging and brain-computer interface lab. So this is a multidisciplinary lab where psychologists, neuropsychologists, neurologists, bioengineering, ICT specialists, physiotherapists, speech therapists work together in an environment which is devoted to bring as much as possible the result of research into clinical practice. And on the right side of the slide, there are two examples where, for instance, the brain-computer interface technology, which allows to connect the brain directly to a computer, so bypassing nerve and muscles, can be used now in rehabilitation, for instance, of motor function after stroke, or it can be used as actually is, it was born for empowering and enhancing communication and interaction with the environment for people who have somehow lost or heavily reduced the possibility to communicate and to interact with the environment. So this type of research allowed us to open a service, an IT service within the foundation, so within the hospital, where we work every day with people with disability, which will be permanent or not, because we don't know. In many cases, it is not yet said, because they are into the hospital just at the beginning of their rehabilitation program. So what we do is we, as we have already heard from other speaker, what we do, we as a multidisciplinary team work with this patients, investigating their needs and their caregivers and relative needs, and based on this and the desiderata of the person, we suggest, we design, create a technology solution, AATE solution, to empower again communication and interaction. And so this is, we think it has two main, it's twofold valuable. First, to introduce AATE service and technology right at the beginning of the rehabilitation, because first, this improves the communication of the person into the hospital with the clinical staff. And this, of course, has a positive impact on the rehabilitation outcome, independently from the type of program for rehabilitation these people are undergoing. On the other side, we prepare, in case of a permanent disability due to several neurological disease or lesions or damage, we prepare people to go back home already, hopefully, with their assistive technology tools, and so to start using it at home, and of course become confident, the person and the caregivers and relatives, to the use of AATE service. This also, we think, will increase the confidentiality somehow, and the long-term use of AATE service. To answer the question, yes, so first of all, as an MD, but as a person who work in a medical environment, we embrace the CRPD in our work, basically looking at the article like the 25th or 27, which have been already mentioned, which means to generate awareness and in medical staff and clinical staff generally, and also to foster AATE service and tools very early in the rehabilitation program, as early actually as possible, in a multidisciplinary environment. And also, this is very, it is very important. And so, and this brings me to the other question, or anyway, to outline the barriers that nowadays still prevent the approach based on convention for rights for people with disabilities in the medical setting every day. The barriers are mainly, they have already been mentioned, by the way, they are mainly the fact that the vision in medical environment, medical provision settings is that is very much medically oriented, sickness oriented, and not person oriented. And so this is, to me, the main barrier, because if you don't consider the person as a whole, and you don't really have the possibility to really foster the rights and the overall rights in every aspect of everyday life of people with disability. So, which means that we need to increase awareness in clinical staff, medical staff, and especially in medical settings. And for instance, we are partners in a European project, DigiSkills, who has the ambitious of deploying new courses to train professionals who will work or will have contact with 80 centers. And so then, yeah.
Thank you, Donatella. I am sorry, it's great listening to you, and it's fantastic the things that you're saying, and especially to hear that from a medical professional like yourself. I can imagine that those barriers actually exist in such a structure, but it's also amazing how you managed to combine the research with supporting people then in the follow-up track out of the hospital back to their homes. Yeah, it matches very nicely with the presentation you had before from Yusra, which is very much you know, in the community, and your service is very highly specialized, but actually we're all working for the same goals. So thank you for that.
Thank you. Thank you.
Yeah, I have to pass over because we're 10 minutes from the end to Klaus. Klaus Herkner is from the Austrian Association in support of the blind and visually impaired people. Klaus is also an expert on European issues and integration, and also very much forward looking into what technological development has is preparing for us. So my questions to him after his brief presentation of his work is how at organizational level you're anticipating the change. So what kind of technologies do you think you're coming up, and how do you think you will be able to implement them in your daily work? Klaus?
Thank you very much, Evert-Jan, for having me here. Let's start with a saying it that's in my age, you know it. Let's come to something completely different now, because we are one of the oldest organizations here in Austria. We are founded in 1935. We have about 7,000 members and 300 persons, or 400 persons, when you count the volunteers working for us. And we developed from a pure representation service organization for the members to service providers within the last 20 years. We are a full service provider, especially for visually impaired and blind persons. As you know, blind persons are only a small amount of the persons that are touched by visual impairment. It is the same thing in all countries. So we see us more in the corner of the persons with visual impairments, with about 400,000 only in Austria. We do legal advisory, advisory for low vision, for assistive technologies, from the device to financing to the legal points. It means when the persons have problems and they have to sue, we go with them. Then we have a pension home with a care department in the mountains of Austria, and all these stuff like leisure and recreation opportunities, etc., etc. But one of the most important things for me is that we are working also in diverse and various projects and not projects and organizations and bodies working in the field of standardization, working in the field of ICT accessibility. That means the Austrian Standards Institute, CENELEC on European level, the ISO, the ITU, and EISPD, as well as ETF, G3 ICT, etc., etc. I don't have to spell all these names. And what changed? What changed for me? ICT is the icebreaker, is the game changer for persons with disabilities in the last 20 years, in the last 20, 30 years or something like that. Yeah. I always mention when I'm speaking to people, I always mention for blind person, for example, wanting to read the book. 30 years ago, you had to have a second person or a third person who reads out loud for you. Or you have to have a book converted to Braille, but only 2 to 3% of all the books in the world are converted to Braille. But nowadays, you can take every book, you can take every magazine that you want, sitting in front, sitting in a table, sitting in your bathtub, in the next to the swimming pool or whatever, and listening to it on your smartphone or whatever. But it has to be accessible. and that's one of the main points that we lose. New technologies doesn't mean automatically that they are accessible. You have to bear in mind that the information that is transported by these new technologies have to be accessible for persons with disabilities, and not only for persons with disabilities, for the growing share of persons that are 65 plus, for example. When you look in the, you only have to have a look at the demographics. Then you will notice that in Austria, not only in Austria, but in the European Union as a region, we have in 2030 about 25 to 30% of the people being older than 65. Means 65 plus, and you see the technological advancement going on in regions, in societies with old society with older people, like in Japan, is far more outreaching than in Europe, for example. The access for information, and the accessibility to the access for information is for me one of the key points. So we have to work in all these pre-level stages, like in standards, and so that we can be aware that accessibility is also in the work of the standard bodies, and at the universities especially, bring accessibility to the curricula, to the body of knowledges of the universities. We have to start from the beginning, from the scratch, to make the people aware that accessibility is not only a thing for persons with disabilities, but also for all of us, and in the name of design for all, for example. So, and I promise to be short, to leave 5 minutes for 2 questions. Okay.
Thank you, Klaus. Yeah, we're running a little bit out of time, which is was to be expected. But thank you for that overview, Klaus, which was extremely interesting and inspiring as well. If there are specific questions, now this is your moment. The floor is open to anyone, to either any one of the panelists, or maybe also Julia, who's still here, or Camille or Laura. Please, if you want. Otherwise, you can always use the question and answer facility at the bottom of your screen. I agreed with Dimitri that also after closure, it will remain open for more 5 minutes. So if you want to ask a specific question or to get in contact with any one of the people that have spoken today, you can leave your message there, and we'll make sure that they get it and respond to you. Any one of the attendants wanted to ask something? No? Okay. Well, then probably I think everything was quite clear. Then I grasped the opportunity to close this webinar in time. Thank you again all very much for your participation. I think we got it came very nicely together, exactly how we had it in our minds, with the different presentations, which were very complementary. Thank you to Camille and Laura for bringing in the specific perspective of the persons with disabilities that we support. And I hope to see you on the next webinars as well for ESPD. I know Magdalena posted the program and the link in the chat, so you can still have a look at that. And I wish you a very nice further afternoon. Thank you, everybody.
Thank you.
Thank you very much.